Hi everyone, so my presentation is about Menkes disease. A quick outline of what I'll be covering. So I'll be looking at the inheritance and symptoms, the effect that it has on development, the mechanism of the disease and the enzymes that it affects, and the diagnosis and treatment. I'll also be highlighting some interesting words and their origins throughout as well. Menkes is a disease that affects copper metabolism in the body, and it affects many systems, and that's because it causes some areas to have an accumulation of copper, whilst other areas have a lack of copper. So the effect seen depends on which of those is occurring. So it's neurodegenerative, so it causes a gradual worsening in neurological symptoms. So I thought this would be an interesting word to look at first. So neuro comes from Greek nerve, which means tendon, cord, bowstring, or strength and vigour. So I thought that might be because of the way nerves look like string sometimes. And then there's degenerative, which comes from Latin, meaning inferior to ancestors or unlike one's race. So I thought that could be due to it being worse than expected. So there's no cure, and most patients don't live beyond the age of 3. Many die much before this, and in a few rare cases, children have lived longer, up to around 10 years, but that's really rare. So it's X-linked recessive inheritance. So it mainly affects males because they only have one X chromosome, so if that one has some mutation, then they'll get the disease. So the word recessive was quite interesting because it comes from Latin. It means to go back or withdraw or retire, and I thought that might be because of the way the phenotype of the recessive allele withdraws itself, because it's not seen when there's a dominant allele present. So the inheritance of Menkes disease is a mutation in the ATP7A gene, and that's located on chromosome XQ21.1. So chromosome is quite an interesting word to look at because chromo comes from the Latin or Greek chroma, which means colour, and that's to do with the way the chromosome changes colour when it's stained. And then soma comes from the Greek soma, which means body. So despite being an X-linked disease, Menkes can affect females too. And this can happen if there's an X autosome translocation. So autosome just means it's not a sex chromosome, and translocation means comes from Latin. It means a cross and a placing. So it's essentially where they're switching places of genes. Some affected females show pillae torti, and this is the classic presentation of children with Menkes disease, where they get twisted hair, and that's literally what it means in Latin. I've got a picture of that a bit later on to be able to see, but it's a really distinctive type of hair that Menkes patients show. There are no known females that show signs of classic MD, which is where you have neurological symptoms involved. It's mainly just the hair symptoms for females. And the incidence is 1 in 100,000 births, so it's really, really rare. It's not very common at all. Symptoms. So they may present with cephalohematomas and fractures at birth. This can mimic child abuse because these are things that wouldn't normally occur spontaneously. They would usually occur with injury. So there has been a case where a child was taken into custody because he presented with rib fractures, and then upon x-ray showed signs of other healed fractures. So they thought his parents were abusing him when in fact he actually had Menkes disease. So cephalohematomas is quite an interesting word. It comes from kephale in Greek, which means head, hemato in Greek means blood, and omas means morbid growth or tumour. So it's essentially a blood clot that occurs between the skin and the skull in children with Menkes disease. They also show lax skin, so that comes from Latin meaning wide, spacious or roomy, so they get a really loose skin appearance, and I've got a picture of that later on as well. They might also show hypothermia and hypoglycemia, so the hypo in this comes from Greek meaning under or less, so they have low temperature and low blood sugar levels. They can also have pectus excavatum, which was quite an interesting phrase. So pectus means breast or chest, and that was later turned into pectoralis in Latin. And then excavatum means, it's in Latin, and it means out and to hollow. So it's essentially a hollowing out of the chest. So it's as if they've got a bit of a dip right under the sternum. For the age of 1 to 2 months, symptoms appear in the hair. So it becomes really sparse and hyperpigmented, so it doesn't have much colour, and it's called kinky hair sometimes, just because of how brittle and wispy it is. And they can also have pill-eye torti, as I've talked about. From 2 to 3 months, seizures can begin, so that shows the first signs of neurodegeneration. And they may also have digestive problems and trouble feeding, and many of them need to have feeding tubes to help them eat. They can have bladder diverticula, so diverticulum comes from Latin meaning a bypath or to turn aside. So it's essentially an outpouch that occurs in the bladder that shouldn't be there. They can have hypotonia, and that later becomes spasticity and weakness. And that can be one of the first symptoms of Menkes as well, because it can affect them not meeting their milestones. So they should be able to hold their head up themselves and start to crawl and things, but they can't do that because of the muscle weakness that they have. They have really low muscle tone. That's what hypotonia means. So here we have the lax skin. So you can see it's really, really wrinkly and loose. That's a 3-week-old with Menkes. And then here we have the kinky hair. So it's really fine. It's got no colour, really, really sparse and brittle hair. So in terms of development, pregnancy and birth are usually uncomplicated, and they may have a normal birth weight. So there's no indication that there's a problem at first. Up to the age of 4 months, they show normal smiling and babbling, so again, no indication of a problem. But then from 5 to 6 months old, there's a notable failure to develop, and they may even lose skills that they've gained previously, and they have a general failure to thrive, indicating that there is some kind of problem. So the mechanism of the disease is that there's mutation in the ATP7A gene. That would usually produce an enzyme called ATPase that's involved in copper transportation around the body, and this is obviously crucial to copper homeostasis, so balancing the levels of copper in the body. So the word transportation comes from Latin meaning trans, beyond and across, and portare, which means to carry, so it carries the copper around the body. And homeostasis comes from homeo in Latinized Greek, which means like, resembling or equal, and then stasis, which comes from Greek meaning standing still. So essentially it keeps things stable and at equal levels, and the levels that they should be. So ATP7A is also involved in copper absorption in the small intestine, so it absorbs it from the small intestine into the bloodstream, and the transportation of copper across the blood-brain barrier and blood-cerebrospinal fluid barrier into the central nervous system. So when there's a mutation, copper is not absorbed from the small intestine, so you get an accumulation there, and it cannot be transported into the central nervous system, so you have a lack of copper there, and that's what causes a lot of the neurological symptoms. Copper is also needed for many processes like synaptogenesis, so that means the creation of synapses, so the junctions between two nerves, and also the development of axons. The ATP7A also helps incorporate copper into enzymes that need it in order to function. And these are called cuproenzymes, which just means that they're dependent on the copper transporting ATP that are affected. So this is just 4 examples and the symptoms that they cause, but there are many more enzymes that are affected, and there are so many more symptoms that can result. There's such a wide range of symptoms. So in terms of diagnosis, the first indication that there may be a problem usually arises from clinical signs, so the lack of development, the seizures, all indicating that there's some kind of problem. But it's quite difficult to pinpoint Menkes disease unless you know there's a family history, because of its rarity. So serum copper and ceruloplasmin are usually low, but this is only after the age of 3 months old, and before this time they may be within normal range, so this test is only useful after 3 months. You can also do genetic testing, so this can be either neonatal or prenatal. So neonatal means in the period just after birth, so neo meaning new and natalis meaning pertaining to birth or origin. And then prenatal, the pre bit comes from Latin meaning before in time or place, so you do it before birth. And you usually do this if there's a family history of Menkes disease. So it's usually diagnosed at 3 to 6 months old, as that's when the symptoms first become really prevalent. Treatment can be really difficult, and the success depends on the amount of functional ATP7A that they have. because if they've got a little bit, they can still transport a bit of copper, so it just depends on the level. Copper histidine is the main treatment, and it ameliorates many symptoms. So that was quite an interesting word that comes from Latin, means to grow better. So it essentially improves the symptoms of Menkes disease, but it's not a cure. So it's injected in order to avoid the copper being absorbed into the gastrointestinal tract, because it would just accumulate here, meaning that it was pointless injecting it. So in summary, Menkes disease involves a wide range of symptoms, and this varies greatly between people, as do life expectancies. The underlying cause is an uneven distribution of copper, and there's no cure, but symptoms can be controlled to a certain extent. And etymology features in every part of the disease, as we've seen here. So these are my references, and thank you for listening.